Good evening, everyone. My name is Kathy Harley, and I'm the guest moderator for the webinar this evening. This webinar will update you on the ORNAO Revitalized Association Plan. So all of you need to understand that this plan has been a work in progress since 2019. And the work continued throughout the pandemic despite many changes. And now the plan has come to fruition. Your ORNAO executive is ready to move the plan forward, and they would really like to obtain your feedback and your comments so that they can really understand what your perception is. The focus is on the ORNAO membership and bringing value to each and every one of you. I would now like to take the opportunity to introduce you to the 3 executive board members of ORNAO who will be involved in this presentation. First of all, we have Denise McLaughlin, and you can see her here on the screen. She's the current president of ORNAO, and she's a certified perioperative nurse who has worked in the operating room since 2001. Denise is currently a clinical educator at Hamilton Health Sciences in the operating room. She is also on the faculty of perioperative nursing at Mohawk College in Hamilton, Ontario. Our second executive member present this evening is the ORNAO past president, Deb Bastone. And you can see Deb here on the screen. Deb is a certified perioperative registered nurse, and she did serve as the president of this organization before she became past president, and has had various different roles on boards, namely the ORNAC board, and also NINA, the Emergency Nurses Board. Deb currently works at Lake of the Woods District Hospital in Kenora, Ontario, and she has both a perioperative nursing and emergency nursing background. I would also like to introduce the treasurer of this organization, who is Blair Winstanley. He's a certified perioperative registered nurse, and he's a full-time staff member at Lake of the Woods District Hospital in Kenora, Ontario. He served as the president of SCORNA, and he's been working very diligently to sort out all of the finances for ORNAO. And so what we'd like you to do, if you look on the navigation bar, you will see a question and answer box. And we would like to everyone to put the comments and questions into the Q&A box. And then after the presentations are done, I'm going to come back on and I will facilitate the questions with the group and the executive. And so now I would like to turn things over to Deb Bastone. No, just 1 second.
Just need to see the slides.
Yeah, Troy, can you just get me back to the co-host? Okay.
Thanks, Kathy. Sorry about that.
No worries.
Okay, so we titled this our ORNAO Revitalized Association Plan, with the idea of continuing to create an association where ORNAO members feel supported, connected, and resourced. Next slide. So our meeting objectives. We're going to provide the ORNAO membership with the new plan for sustainability regarding governance, organizational structure, and touch on partnership. We're going to inform the members of the ORNAO educational plan funding policy. We're going to try, and our goal is to engage members into the new ORNAO structure and become active participants. In looking at our mission statement, we have stated that ORNAO will connect perioperative nurses to advance their perioperative practice through education and sharing evidence-based information to support the delivery of safe and effective patient care. Our vision statement is excellence in perioperative practice for Ontarians through a passion-driven network. Our ORNAO values, again, this can be viewed on the website in looking at knowledge, collaboration, respect, professionalism, and continuous quality improvement. So where are we right now? So we've done scans, environmental scans on our different regions, and this was presented before last year when we did just kind of an update or where we were strategies and kind of introducing the idea that we felt a need that the association needed to be revitalized. So if you look at the 2015 stats, we were at 432, and we have been steadily declining. 2021, we were at 217, and as of December 31st of last year, we were at 157. Next slide. So in also looking at the regions, we did a scan again there as best as we could. And basically out of our regions, we have one that we're aware that has become active. Other areas, such for example as Scorna, decided to become non-active and had their funds returned into the provincial association. So we have, when we were looking at this, we felt that we couldn't sit any longer and keep doing this the way we had always done things, that we needed to create a new association that was meeting the needs of the membership to try and draw the membership back in. So our revitalization. So under governance, we looked at reestablishing the executive board and also doing policy and procedure revisions, which hadn't been done since for many, many years. And we're working on these policy and procedures to really reflect the current environment that we're in now, and we're really trying to reflect what our membership is looking for. Regarding finances, we sorted out the ORNAO finances, and we will be doing a financial update. But just to make you aware, sorting out our finances took us at least a year and a half to finally get to the point of where we understood where we are at. We met the criteria of what was in the bylaws, and we went forward from there and worked with an accountant to get everything sorted out as cleanly as we could. The other thing was we looked at developing a new structure for ORNAO, and we will be discussing that also later. Regarding education, we have put together an educational framework for ORNAO, and it is developed to fit in with the ORNAO restructuring. It reflects attempting to do webinars and addressing the issue of the webinars we did put on that we had low attendance, and we felt did not kind of have the quality that we wanted. So we really delved into that in improving that and really changing the quality of them. The ORNAO educational plan for 2023 moving forward is really been developed to support member engagement and promote education on that membership level. Regarding communication, we really looked at how we could enhance our communications. We have now a new website. We have made ourselves a social media presence through Facebook and YouTube. And you'll also notice in the right-hand corner of the slides that we have created a new logo to increase our brand identity. So rebranding, as I said, we developed a new logo. We also, as I said before, have designed a new website with more transparency and easier to navigate. Fiscal responsibility. We rewrote the financial policy. And one of the things we identified is in past conferences, there was never really a budget set out. So the board moving forward, when we do get to the point that we are able to offer a conference again, for our conference chair, we definitely will be assigning a budget of which we will be staying, maintaining and adhering to. We also looked at partnering with vendors to support our webinars, and that's something Denise has been working on. We've sent out with our vendors, which was a bit of a challenge because going to the current president for the Ontario Vendors Group, they are kind of in flux right now. And so we're attempting at the same time as promoting these webinars is to create a database for us to know who to contact. And that definitely will be something we'll be going out into the membership for to see that if we can get a pretty robust vendor list. We also identified that the money needs to go back to the membership through clear policy. And we wanted the funds to benefit the members, and we have developed a criteria to access funds for the membership to attend conferences and other things that we'll discuss later. So our organizational structure, as you can see, basically the executive has stayed the same. Our ORNAO board members are now, instead of having regional executives, we are moving to have regional representatives and are developing or have a work description that goes along with that. On our external, we're looking at our ad hoc actually is marketing and membership education. Ad hoc would also be our conference chair. And we're also looking for our interest groups. So we're again looking at reaching out and involving and gaining potential future member interest regarding our students, anesthesia assistants, and registered practical nurses, and bringing back in our RNFAs. And externally, as part of our organizational chart, we have our CPA bookkeeper, webmaster, social media, IT guru, and ORNAC Ontario director. So I spoke before about revised ORNAO policy and procedures. All of our ORNA policies and procedures are in the process of being updated. We have Kathy working on that. And once our board is in place, that will be probably one of the first agenda items, is to review those policy and procedures and pass them. We have, as part of our policy and procedures, identified that we are going to have membership meetings twice per year, with one of those meetings being an AGM in June, plus one other. And that was something that wasn't part of ORNAO in the past, were the AGMs. So we feel that that's really important to have to keep our membership engaged. Blair, are you on?
Hey, yeah, I'm on, sorry.
Okay, so now Blair's going to present this piece of the ORNAO finances.
Okay, my name is Blair Winstanley. I've been helping Debbie and Denise out with the ORNAO members, and basically tried to get the financing all straightened out here. So I'm sure Debbie touched on it.
I did.
But basically from January 1st of 2022 to December 31st of 2022, we had 18,877.18 of revenue. 5,800 of it was memberships, 6,900 in expenditures, and basically we had a positive last year. Bank account as of December 20th was, as you can see, $45,419.04. Basically, what we're going to be doing with the fee allocations is the treasurer is going to allocate all the funds and keep $30 per member from ORNAC, basically just in one bank account, but it's going to be easy to figure out which region has that money. You'll basically get those membership numbers in January and July, and then that just gets put into a spreadsheet where we can keep track of how many members are in each region, and thus how much monies would be in that certain area. And then this will obviously all be reported at the AGM.
Just to qualify, for people who may not know, previously what was done in ORNAO itself was that when we received this $30 per member, we would keep 15 and put 15 into the regional ones. We have made the decision that if we're looking for focusing back on the membership, we're going to put the $30 into that member's region. And the other thing that Blair has already developed is an Excel spreadsheet. And as he said, that will be reported at the AGMs. And also the regional reps will have the ability to touch base with the treasurer and see monies that are in the regions. And just to let the membership know, so some of those regions, as I said before, who have become non-active, have reverted their money back into the ORNAO provincial, and that's where we have directly put monies back into those Excel spreadsheets. So when we were talking about before our money allocation in that, those monies we've identified already into the regions of those members who have renewed their membership. So again, ORNAO, our next title is Meeting the Members' Needs. And Denise is going to speak to this.
Hello, everyone. Thanks for joining us this evening. We'd like to continue on with trying to meet the needs of our membership to further build engagement. We wanted to look at types of funding available to support education. We've always sort of had that premise and priority within the organization. We'd like to state very clearly that funding will start on June the 1st, 2023. What kind of funding or type of funding will be available for members to access? We've decided, and this is really along the lines of what we've historically done, registration to attend the ORNAC National Conference, registration to attend the ORNAO Provincial Conference, should there hopefully be one in 2 years, and then also a 20% discount on the full cost of anyone who does their CNA certification for CPN. Not sure that we've done that in the past, but I think it's a nice incentive for those of us who want to pursue that, and really encourage you to do so. And who can access funding? Any active member of ORNAO or ORNAC who are perioperative registered nurses and they reside and are members in good standing of any of the 10 regional areas that have been listed on this slide deck today. Now, as Deb has already mentioned, there are a number of them that have not been able to have successful meetings, and there's been many factors for that. So without any blame, it is what it is. And moving forward, we knew we had to try and do things differently. Okay, so we want to recognize, you know, the contributions of so many people from all of these various regions over the years, and we want you to maintain some of that identity as a group, but sort of centralizing the executive and the funding as it is allocated as per our criteria, which will also be laid out on the website. We can go over those criteria now. Next slide, please. So the criteria will include any perioperative registered nurse who is a current member as stated for ORNAO or ORNAC. They must be in good standing. We changed that to 1 year for 12 months, simply because the last number of years have been incredibly difficult for many people on the call tonight. And so we want to recognize that. Normally it would have been 2 years plus an additional year. We'd also request that any member seeking sponsorship attend 4 out of 9 of the ORNAO educational webinars within the previous 12 months. And that's part of the reason why we're pushing the access to start in a couple of months. We need to get this underway and have those membership attendance records to be valid as well. And of course, webinars will be complimentary to ORNAO members. So I want to really be clear on that. We have been offering some free webinars during the last couple of years where we did try on our own to do this, and it was very challenging. And we had made that free for anybody who wanted to join as a way to be supportive and to try and reconnect across the province. Moving forward, the webinars will be complimentary to the members only. Anybody else who would like to attend, there will be a registration fee. I'm not going to discuss what that is. It's usually a nominal amount. And then filling out an online application requesting the funding for any registration or support for educational events. Next slide, please. Okay, and so funding process and reporting of funds to the ORNAO members. Funds are based on membership registrations and are paid through ORNAC. $30 of each paid membership comes back to ORNAO, and the $30 will be allocated to each member's region, as already stated by both Blair and Deb. The funds will be tracked by our treasurer. In this case, it's our lovely Blair, and reported to the ORNAO membership at the annual meeting, as already mentioned, with the plan to be in June. And we think that that would work quite well with membership numbers coming twice a year as well. In terms of how we would look at minimum balance, we really want to sort of, state that we wouldn't want to overdraw those accounts. And so we will be setting a minimum balance for any funding so that we will not go below a certain level of whatever the executive decides that to be. And so we want to make sure that we have sustainability moving forward. And so if we overdraw, that will really impact our ability moving forward. I'd also say that, as an example, so I'm from the Hamilton area, and so ORNAD, sorry. I don't want to misspeak or misspell anything. In terms of ORNAD, let's say we had a set of monies, let's say $1,000, just for equal conversation here. And if we got, let's say $10,000, that's better. And let's say we set it at $1,000 minimum balance. Well, as members start to apply for funding, that $10,000 will be reduced over time. And so our hope is that as we start to generate more members into the groups, those funds of $30 per member will then go back into your sort of pot of educational resources to ensure that you never get below that minimum amount, as previously stated. Do you want to add anything, Deb? Or are you happy with that?
No, that's the idea behind it. Yeah.
Because we really do look to our members we're a nonprofit. And so we really need our membership to support, and we look to our vendors by way of webinars and many other supportive activities that we engage in collaboratively to help further things along as we move into the future. And it really is about what are the healthy revenues that exist for each region. And those healthy revenues will be the support for future funding. as we move and hopefully build our membership and start to get back to conferences in person and everything like that. Okay. And we're going to move along. Thank you. And the ORNAO webinars. Well, the education is to support the members' professional development, as already stated. We really feel strongly this is a tenet of our organization, our philosophy. The webinars to be supported by our vendors. We have reached out to them and we are in the process of planning. We also have a IT consultant. So Troy Curtis is running this for us tonight with the help, obviously, of Kathy Harley. And much success in the national conferences that Troy's been involved in, and many of you may know him from previous ORNAC conferences. So we're very hopeful that we can have this professional edge, put forth this endeavor to our membership, and they will be webinars utilizing Troy's expertise. He will automatically send reminders, which I think is a good reason why we have such great attendance tonight. So thank you in advance again, Troy, and for the members who were able to make it this evening. Again, 9 webinars will be held throughout the year, and we will be sending out certificates of attendance as we have done when we had actual in-person meetings. So Troy will manage all of that for us, and he will also have an archive. So if, for example, a member couldn't attend a session that's tonight and they'd like to still see what was discussed, whether it's this meeting for membership and the revitalization or an educational topic, they will be able to access that. We do have our own YouTube account, and the ORNAO members will be able to access previous education sessions or meetings. And most of our meetings, by the way, are virtual. So that's been really great. We live in different parts of the province. And so that'll help with more centralized type of executive as well. And all the members can access that. So we're really looking forward to moving forward with technology as well in a professional, streamlined way.
Mm-hmm. I just want to add to that too. We're looking at our ORNAO webinars as being the association's revenue stream when we can build it up. And that's why we felt strongly that the members' monies that they have paid for their membership would go into their regions. So we're hoping as this builds, we will be able to have the association's own revenue stream, and the membership's money are going back to the members. So that's the whole idea.
Yeah, very important that we identify that the operational costs for the webinars and the expert consultants that we've been working and partnering with, those funds are really coming from the vendors' sponsorship. Sorry, there goes my little puppy dog. I hope he remains quiet. In terms of the next conference, it's coming up in Quebec City. I'm not sure. Tell us in the chat who's able to attend. I mean, I know sometimes it's hard to get time off work, but April 26th through 30th, we hope to see you there. One of the things that we'd love to do is connect in person with our Ontario delegates. So please let us know. Send me a message if you're planning on attending, and we will, Deb and I and Blair will put something together so that we can connect as a group in person, which we haven't done since Halifax. It'll be really lovely to see people in person if you're able to attend. And then in summary, would you like me to pass that back to you, Deb, to tie it up?
Yeah, so basically in summary, the ORNAO executive is committed to rebuilding ORNAO to better meet the needs of the Ontario Perioperative Nurses membership. Your continued feedback is encouraged to support the ORNAO revitalization. The new board structure will drive the new nomination and election process. And also, we are very committed to being transparent with finances. We are committed to implementing this new plan to engage members. And just to let you know, we will be doing the call for nominations. They will be emailed out to the membership by March 15th, 2023. And along with those nominations, we will attach descriptions for those positions so that if there's something you're interested in and to help us build this organization, we are very interested in it. if there happens to be more than one person who's applying, for example, to be a regional rep, at that point, we will run an election in that region for that regional rep. So otherwise, we will be acclamation or what we will be moving forward, because we definitely want to see our association thrive. So to all, thank you for your participation tonight. And we're looking forward to getting some feedback, some questions. Hopefully, we have been comprehensive in our overview of what has happened in the organization. And thank you.
Okay, so I'm now, thank you to the ORNAO executive for your real update on the plan and where things stand and the policies and processes that you're putting into place to make sure that things are done fairly and equitably. And we have had questions coming in, and I've been watching them as they've been coming in. And so the first one, I'm going to address this to Deb Bastone. Where is the Director of Ontario for ORNAC in this board?
If you looked at the organizational chart, we had put the Ontario Director, ORNAC Ontario Director, as one of our externals reporting into the board. So it would be down in the left-hand corner if you were looking again at the organizational chart.
Okay, so there is there is a place for that.
So right there on the lower left side.
Okay. All right. Okay. So we'll move on to the next question. You talked about the discount for certification that their money could be put towards. And the question is, will there be funding support for the recertification?
Yes.
Yeah, so it's both for new people certifying
Yes.
and people recertifying. Okay.
Yes, we had a discussion about that, and we found that hospitals were willing to do the initial recertificate or initial certification, but did not seem prepared to do recertification. And we felt that that was a role that we could definitely champion for our membership in trying to encourage that expertise or that continued professional designation.
Okay. The next question is ORNAO taking over the regional accounts?
Mm-hmm. That's that has been the regions coming to us. For example, Blair was president of SCORNA, was not getting the activity that they felt the people who membership who were involved all agreed that they felt that the money should be put to better use and return the money. And that's where we came from, putting them into the pods so it was going directly back to the membership. We've had several different organizations, and the ones that are non-active have been looking what to do with their accounts because they're really not doing anything with it. So this is we're more than happy as a provincial association to be accountable and to keep those monies for the membership in like Blair was saying, it's kind of in a global, but it's set up in Excel. So we know exactly, and every time the payments come in the 2 times of the year, we're designating into those accounts.
Okay. The next question is, who are the representatives for the Windsor chapter?
There is none. And so this is where we're starting right from scratch. For example, when you looked at all those regions that were non-active, they desperately need to have representation. And so this is where this will come from. So each membership pod region will get a call for nominations for their region, and people who are interested and meet the criteria definitely are more than welcome to become our reps. And with the hope of re-engaging again.
Okay. The next question is around the rebranding process and marketing on social media. Could you explain how the rebranding process and marketing on social media was defined and how it's being implemented?
I'm not clear on what you are asking regarding defined.
Defined, it could be how did you go, it basically looks like, how did you go about doing it, how did you develop it, and how are you going to implement it?
We worked with Troy, and basically and also you, Kathy, in guiding us because of your other expertise with other organizations and their success that they've had. So basically we've been utilizing what's been working for the other organizations to hopefully work for us. And one thing we haven't done yet that has been suggested would give us more exposure was with LinkedIn, but that's definitely something we can look at. So it's been fairly new that we've been trying it, but we definitely are being guided by somebody who has more expertise than certainly I do.
Yeah, and I think and this is going back about a year ago, there was a plan put together that really did an analysis of the current situation of ORNAO. And the plan was developed in order to give ORNAO a refresh, because things just couldn't continue the way they are. The membership was declining and things really needed to be turned around. And so one of the areas that was identified that needed to be strengthened was the brand of the association and the marketing approach. And so that was built into the plan. And so from there, it resulted in the new logo, which was designed by Troy Curtis. And a whole plan is being put together to take that forward into more social media and other marketing areas. So I think it really comes down to, it was a plan.
Yeah.
Okay.
Can I touch on that just for a minute as well?
Yeah, sure.
So the website obviously needed to be kind of updated. That kind of went hand in hand as well. And like Debbie said, I was a regional rep, president prior, and it was just getting way too difficult to actually have people come and attending meetings. So I don't know, I'm sure everybody else in the regions may be having some of these problems. I know I've talked to Lorna in Thunder Bay, and they were having problems as well. So it's just the direction we should probably go in.
Yeah. I'd like to also add, thank you for those comments, Blair, in terms of accessibility for staff as for membership as well. So, everybody has a phone in their pocket. People are on their phones all the time. That really is the way to contact membership. And ease of use. I think certainly transparency is a key word in tonight's discussion. And also I think the archive, having a more contemporary, modern type of website that is user-friendly, that gives you the information at the click of a button in a much easier, streamlined way will be beneficial and more pleasant for our membership. I think it was well overdue, and I'm really happy with the work that we've seen coming from Troy. He's done a tremendous job. And speaking to the experts that we were modeling ourselves under, we can see what's worked for them, and there isn't any reason why it can't also work for us if we plan and we engage the right experts for consultation and strategic sort of planning. Our hope is that we'll really be able to leverage their lessons learned and help really revitalize our membership across the province.
Okay. Thank you. And the logo looks fantastic. So congratulations. The next question is, what year did ORNAO become incorporated?
I think it was back in 2013. But my understanding, what happened was when we were going through, when ORNAC was going through the not-for-profit and restructuring there, we were advised that we didn't need to be incorporated. And on the advice from lawyers that Linda White got, that it was better for us just to leave it and not pay anything, because if we needed to reactivate it, it would be easier. So currently, we have never continued with our incorporation. And that definitely has been a discussion in some of our meetings about whether to do it. But I think from the advice that we had gotten from a lawyer was to leave it. If the new board decides that that's something we need to move forward with, I think my understanding is that we can easily reactivate the incorporation, but currently we aren't.
Yeah, and one of the criteria for that is how much money you're bringing into your organization on an annual basis. So that will definitely be watched moving forward.
Yeah.
Mm-hmm. Okay. The next question is it time to consider dissolving the regional associations? I guess it was the regional chapters.
That's basically what's happening in this new organizational structure because there's basically no executives running except for one that we can identify. And so this is why we've kind of gone along the lines of a regional rep for each of the regions and with the position description, we're hoping that by breaking it down, we will get more engagement from the membership. And also for the people who are representing those areas, there will be the ability to have more comprehensive understanding of the different facilities that are included. Because I will say something that was really, I lost some sleep over this, was the one thing that shocked me the most was Ottawa shutting down. And right there to me was a red flag that if we did not do something more progressive, looked at that we couldn't continue to do how we've always done things, that we might have to have made a decision of dissolving. So this took a lot of meetings, a lot of discussion, really looking at, could we make this viable again? And this is how we've approached it, is to look at our regional representatives who will be transparent on our website so that any of their members in their region can get access to them, that the reps, I envision, will be able to talk to the treasurer at any time to be aware of the monies in their region that are available to the members, that they'll be part of assisting the executive in promoting our webinars, etc. So I have been impressed already that I feel that we've made the right decision in bringing in Troy. Because just even getting the reminders have been phenomenal. And we had a little glitch at the beginning, but that's okay. I keep looking at this as a work in progress and that we can only get better with this.
Okay.
Also, the point of keeping the regional reps in place is so that you have somebody there, but like when we were all separate, we were running meetings, we were doing our own education. If we can all just be in one, organization together, then it's less for that rep to do. Mm-hmm. And then they can come to the AGMs and bring their concerns forward and have a really cohesive group going forward.
The other thing is that the reps will have access to our Zoom, so that it's become more cohesive, that they can work, Troy will have a list of who the reps are. They're asking that they want to do a Zoom webinar. Maybe it's just to discuss the issues in the region, that type of thing. So my vision is that they would have that accessibility to stay connected with the membership.
think
Might
as
even
well-
be, or they might be aware of people who aren't members yet that might be interested in some of the webinars coming up, and they can forward them to them. They may have, like we have in Blair and I work in the same hospital, we have an OR crew group where a messenger can go out, and that's how we're communicating. So there may be things that we haven't identified yet that are opportunities to still engage the membership.
Okay.
Thanks. And if I may just add, I'm sorry, in terms of any ideas that those on the call tonight have, please reach out to us.
Yes.
We'd love to have your input. That's why we're putting this revitalization plan out to the membership and having a discussion so that we can elicit your feedback and give you what you want and support you in the way that you feel is meaningful to continue not only to be a member, but perhaps also be able to spread that to other colleagues as you come along. Streamlining, working smarter, not harder.
Yeah.
Okay. The next question is, do members have to have membership with ORNAC, or can they simply become members of ORNAO?
The way the process works now is that you register with ORNAC and through your geographical area, you become part of ORNAO. So that's where we receive identification of who are members twice a year from ORNAC. But that changed, I can't, maybe Chris can say how many years ago, but that is the process. But you are basically an ORNAO member because of your geographical location. And then further, we break it down. And sometimes people get in the wrong region, and then we will contact ORNAC to put them into the right region. Because sometimes you're just not aware of where you belong. And that's,
Okay.
yeah.
And one participant asked how many people were on the call out of curiosity, and excluding Troy and I, there are 28 people on the call. So we had a very, very good turnout.
Mhm.
The next question, well, actually it's a comment. You keep saying we, but I'm not sure who the we is. So when you're saying we, are you referring to the ORNAO executive?
Yes.
Yeah, the ORNAO executive is
Yeah.
who we is. And someone made a comment to say that I think a lot have been inactive due to COVID, and that definitely did have an impact and could be the case.
Mhm.
And Denise, in her part, mentioned perioperative registered nurses. Who does this include?
I think it includes perioperative registered nurses. I think, nurses who are working in an operating room. I think there could be an opportunity to talk about students, but not from a sponsorship perspective. We could talk about associate memberships for non-voting. If somebody is a BScN and they're taking, or now they're registered, but they're working through this perioperative specialty, I think that would really require some discussion amongst the executive board. But I would say a registrant of the College of Nurses with a perioperative specialty. Now, there are some that don't work in the OR, maybe they're working somewhere else. I think that would require some discussion as well. Most of us who hold that certification and specialty are passionate about the area of nursing that we work in and contribute to. And so I wouldn't want to be so restrictive that we would not encourage someone to be active, but what their membership would look like would really be dependent on their level of activity within perioperative practice, current perioperative practice. I think I've captured a reasonable answer. Would Blair or Deb like to add anything?
No, I think that's.
Well, what about RPNs or practical nurses or licensed practical nurses? Are you looking at including them in this organization?
We have to look to ORNAC.
They are on the organizational chart as
Yeah.
associates, and definitely, we would kind of look at direction of what ORNAC's, because they are calling for a town hall meeting right now, which would be an interesting discussion and looking at the kind of evolving perioperative environment. So I kind of think the provinces are going to take the direction of what their national association is doing. So definitely would probably be a possibility. So yeah.
We'd have to look to the membership. I agree 100% with you. Deb, you took the words out of my mouth in terms of nationally, what's the philosophy of the overarching organization? And then how does that dovetail with our membership, and what does our membership want in this organization? So I think that would be the second component of that collaborative discussion in terms of moving forward. I'm going to go out on a little bit of a limb. I don't think it's much of one, but I will say that, the team takes care of patients, right? So although I am very proud to be a registered nurse and a perioperative registered nurse at that, I would never want that to take away from somebody else who's an excellent care provider for the patients that we all are involved with. But we really do need to seek that leadership and that direction from our overarching body.
Right. Okay. We have someone who has their hand up, Antoinetta Labriciosa. Would you like to speak? Antoinetta, would you like the opportunity to say something? Okay, I did unmute her. Okay, so we'll lower the hand. Okay, and then are registered nurses in day surgery and PACU included in this plan?
No, they aren't, because they're considered peri-anesthesia nurses, and they actually have their own association. We definitely work alongside them, but and definitely there's been discussion of even running conferences, in parallel with them, but that is a different association. Currently, yes.
And if I can just add to that as well, we were successful a number of years ago in the Hamilton area with an evening. We had a lot of membership, and a lot of the members who came obviously were members, as I said, but there also were some other team members. There were healthcare aides, there were RPNs, I don't know if there was an RT or not, but it was around cannabis use in the OR in terms of pain medication, so on post-operatively. It was excellent. It was very well done. We had a lot of team members attend the session for education and come and attend, but they did not hold a membership. So we would say absolutely for education is for everyone. And if somebody wants to come, then they're more than welcome to register as a non-member. And conversely, we will look towards their membership opportunities if we have the credentials to join, and if we want to go to one of their educational events as well. So I think there's some reciprocity that we do overlap practice a little bit, especially in some of our smaller community hospitals. But Deb is right. They do have their own set of standards, their own organizing body. And so we want to respect that, but certainly have an invitation for them to join as a non-member for our educational event.
But just to add to that, I will say that's always been a vision of mine, even back in 2015 when I was president, was a vision of having a conference with our declining numbers and looking at opportunities. And it would be something that would be very logistically something to maintain our identity, but run parallel conferences with MDRD, for example, and peri-anesthesia in that, because there might be some things that working in an operating room would be of interest to us and having been involved in presenting at CSAO when it was that, they had some very good presentations. that were of interest on instrumentation in that. And I think we're missing an opportunity, and I'm hoping at some point that, you know, because perioperative nursing goes into so many fields, like even infection control, different things like that, that would be interesting to create that in a kind of conference environment where you can gauge knowledge and you actually create even a more team environment. It's something I've always thought would be unique and would be a trend that we could, you know, be maybe pioneers in. But anyways, that's something I've always wanted to see.
Yeah, and there's one more question here, and it says, what do you mean day surgery nurses? I'm an RN in a surgical center who only does same day surgery.
Oh, when I was looking at that as day surgery, like recovery.
Oh,
So if you're talking about being, whether you're working in a clinic or a day surgery setting, you're still in a perioperative setting. So you are considered perioperative nursing. It's just not maybe in a hospital setting, example. Clinics and then according to accreditation, you're still following the same. And if you look in the front of the ORNAC standards, they identify the areas.
Okay, and so we're moving up towards 8 o'clock. And just to wrap up, I would like to ask each executive member for one last comment, and I'll call you by name. Blair, if you could just leave, you know, one last thought for the ORNAO membership.
I just want to thank everybody for coming who were able to come into the meeting tonight. I hope we can get the ball rolling and really get going with the webinars and getting a lot of you know, feedback and people you know, chiming in and joining the association and really spreading this, because I think if we all work together and do, you know, everybody plays a part, and we can make this a pretty special thing.
Yeah, thank you. And Denise.
Well, I'd like to echo what Blair has said, but I better come up with something myself. I would like people to think about reigniting their passion for perioperative nursing. I think many of us are on this meeting tonight because we care. And likely we've been to many, many meetings over many years. And so my hope is that moving forward, our team, our group can grow and we can learn from one another. And any feedback that you have, please do not hesitate to reach out. We really want to engage and be collaborative in this evolution as we move forward. Thank you again for joining.
Great. And Deb.
This has been kind of a 4-year passion, and I am a very passionate perioperative nurse in the sense that I truly believe in it, and I think that we need to be there for each other, and in promoting the professionalism, the skill level that we have to make those the patient experience positive, to make a surgical procedure move forward smoothly. And I really hope that that our association can get revitalized, re-energized to be really a dynamic and a resource for our membership, and something that people recognize and see it for what it is.
Right. And if people who are on this webinar would like to provide feedback, where are your emails located? Or how can they provide feedback?
They're on the website. I believe they're on the website.
Yeah.
Yes.
So to go to the website.
So there, I think on one of the slides, it said president at, it's still ornao.org.
Same. Yeah.
Yeah.
We've
President at ornao.org.
Yeah. One more thing I just want to say before we sign off is that I did send out a call for nomination for a rep on ORNAC's Ontario Director Rep. We did not have any response. I really would like people to consider it, because we can nominate from the floor at the ORNAC conference. And I believe Sharon's on, the president of ORNAC is on our webinar here. If I believe, and perhaps even Chris can clarify, if we do have somebody come forward that is interested, I can we nominate from the floor, Sharon, or can we submit a nomination later? So, but if somebody would consider that, I think it's a very pivotal position. Angela Russell has been our Ontario director for the last 4 years, I believe, and is now stepping down. And so it's really important that Ontario be represented, though you're not representing Ontario per se, but giving some perspective to the national board.
Yeah. And Angela Russell has said you can ask to appoint somebody.
Okay.
Yeah.
So if somebody is interested, please let us know. I believe it's a 2-year commitment, and it will be identified at the ORNAC conference. So if somebody is definitely interested, please consider it. You can contact me to talk about it, or even Angela. Okay, so Angela says it would be a 1-year appointment until someone is nominated. So even to do for the 1 year would be so helpful to us as we're reorganizing and moving forward with revitalizing our association.
Okay. And just to reinforce that this group will be putting out a call for nominations by mid-March. And so please stay tuned for that. Getting involved in your ORNAO organization and ORNAC are great leadership skill development opportunities. And so please consider getting involved both with the provincial and with the national organization. And so we are on 8 o'clock, and I'd like to thank all of our executive panelists for this webinar, and thank all of you for attending this evening. And thanks to Troy for his amazing IT support. And we will hopefully see everybody soon.
Thank you, Kathy.
Okay. Thank you, everyone. Really appreciate your participation.